Hey, this is State Superintendent of Public Instruction, Chris Reykdal, and I'm going to take my mask off here, but in our organization, while we are mostly working remotely, we wear our masks when we're in here. I've got a film crew of 2 with me, and they are roughly 8 and 14 feet away from me, and we try to practice safety here, but really want to encourage you to wear a mask. It is the number one thing we can do to get this virus under control. I will put this on when I'm done filming, but I want you to be able to hear me, and I want to make sure you see our graphics. Today we have a pretty critical moment here in our state. We've worked on reopening. You've seen the guidance, and I want to make sure you understand just how much has changed in the last 10 to 14 days. There's certainly a different expectation out there. Unfortunately, the virus is raging in other states. That's picked up a lot of national attention. But even in our state, where we've done a remarkable job getting it under control since April, cases are emerging again, hospitalizations are up, and unfortunately, those 2 things tend to lead to higher mortality rates. So we're going to walk through a little bit of that in the data. I also just want to make clear to everybody that the safety of our students and our staff has been first and foremost in our planning efforts. Everything about this closure initially by the governor and all of the work that we did subsequent to that was all about figuring out what is best for health and safety. And I'm really proud of what we have done. It helped us get our caseloads way down. You've heard me say this before. But we're, 2.3% of the U.S. population and only about 1% of the loss of life. So while our state started as a hot spot, we've gotten significantly better, but a lot is at risk here. So let's look at the reopening. Let's look at the data from Department of Health along the way. And then I want to make sure you understand the framework that we put in place, but why things may be changing right now and why you're hearing so much angst out there about reopening schools. So let's jump into the data here. We start with Department of Health data. These are confirmed case counts right here. We're also going to look at hospitalizations and unfortunately death counts. But in terms of confirmed cases, this is the duration of the event so far. This is our planning horizon. This is when we began to think about what we would do to reopen schools in the fall. We brought a group of people together here in May. You can see that the case trend was certainly down and then leveling off and flat. And we always knew that cases were expected to rise. The number of people who were going to get it was going to go up because that's what happens, whether it's influenza initially or if it is in fact COVID-19, you see more people get it. That's how you get to herd immunity. When you test more people, you confirm more people get it. So it's always about multiple measures and not just cases. But cases are on the rise again, and since we issued our guidance here in early June, you see that cases are up. I would encourage you to not pay too much attention to this because these gray bars are data that's not yet in and confirmed, but it sounds as if this data is going to continue to rise, at least for the foreseeable future, unless we can really double down and get our state to focus universally on face coverings. It is our best opportunity. Department of Health also produces hospitalizations, again, the same time period. Here's our planning window. At the time we were planning school openings, the trend was down significantly in terms of hospitalizations. Our state did an amazing job getting this under control. We saw it level off here, and we sort of expected, again, as more people would get the virus, but we kept it under that critical threshold of our acute care systems to be able to handle it. We thought we could keep this number quite flat. Unfortunately, with the reopening, it's been robust in some places, and we see pockets of significant risk. And unfortunately, hospitalizations are on the rise. And again, I think the experts believe that number will actually continue to climb as these become confirmed cases and the data catches up. The last thing we've been looking at along the entire duration of this and the safety of opening schools is unfortunately deaths. And you really want to watch those. But during our planning phase, deaths were way down. The trend was coming down. It had leveled off. It is still level. This has a lot to do with how our hospitals are more effective at treatment, early interventions. They have certainly created medications that are more effective and respiratory treatments that are more significant. But again, it looks like the data lags, but as cases and hospitalizations increase, typically this number rises, and that's what has people very, very concerned. That unfortunately it looks like our loss of life will continue now at a pace that isn't on the decline, but perhaps level or increasing. And that's part of the larger anxiety that's happening in Washington. But given the data and the trends that we were at least observing through our planning process, we really wanted folks to understand that we had 5 criteria that were essential. We looked at other states and other countries, and nobody put together a more robust framework for the health of our students and our staff. Daily screening, everyday checking or attesting to the safety and health of our staff as they come in, including temperature checks. Cleaning regimen, more robust cleaning of our facilities, particularly common areas, with CDC guidance and a very prescribed publication on how to clean and with all the proper contents of cleaning. Hand hygiene, washing our hands in a regular routine. We're typically very good about that in elementary school. We teach kids that practice as a general health and safety measure. We get a little lax on it in middle school and high school, but our plan was to certainly have hygiene be a predominant function of every school, every student body, no matter where they are, both soap, warm water, and proper time of cleaning, as well as sanitizers throughout. Mandatory face coverings. This has become an absolute staple for success in the country. A huge thank you to the business community who has really embraced the importance of this for reopening the economy and schools. It turns out that even folks in Washington, D.C. are now suggesting this is one of the best things that we can do to make sure that we control the virus. And lastly, 6 feet of physical distancing. This is important. This is the typical distance of a droplet on a sneeze or a cough or even speaking or singing. These 5 elements combined created a very robust opportunity for us to open schools safely because we have never seen such a consistent layer of protective factors. But alas, there is nervousness with cases going up and a lack of testing nationally and in our state, not just testing in volume, but in quick response. Getting results back quickly is how you can do contact tracing. I think those things are still lacking in the state and in the country, and it's been a very big frustration. Our partners in Germany test weekly. We see other countries testing not quite as frequently, but they're able to really identify cases quickly, do their contact tracing, and it creates a better outcome for them with respect to containing the virus. The Department of Health has also worked with the University of Washington, just amazing expertise there to look at more than a dozen countries around the world. You can see here that they look at many metrics. Most of the metrics that we included are considered in their categorization, not really their cleaning regimens. Those are the one things we've required that no country seems to at least identify. But what we observe is the Denmarks and the Norways of the world who have had real success reopening schools safely really have met all of those metrics. And they do contact tracing generally, and they have significantly more ability to do testing. Israel and Sweden went the other direction. No physical distancing, no face coverings. They believed early that young people were less likely to get it and spread it. That is not necessarily the case. That is not the predominant science. It certainly is less impactful statistically to young people, but it turns out they get it and they spread it. In particular, high school age kids are likely to spread it just as much as adults based on the current research. So it gives you a picture of how hard our state has worked to reopen schools in a way that we think is safe and healthy, but we don't have the tracing necessarily in a robust way, and we don't have the testing, and that anxiety is building. Districts are working really, really hard to talk to their communities, to survey parents, and increasingly parents and staff are saying they don't feel safe coming back because cases are on the rise, hospitalizations are on the rise, likely deaths are on the rise in our state until we get it under control. And there is certainly no evidence right now that testing at scale is in place. So I am challenging you to be very gracious with your local districts, but be in space with them, contact them, ask them what their planning effort is. They are working through partial openings. They are working through full openings in some communities where they think they can do that safely. They are working through fully online models to start the school year, and I think you're going to hear a lot more about that. Districts just want to focus on the safety of students and safety of our staff, and it's becoming obvious to them that there are too many variables at play right now to ensure that, and our parents are very nervous, and lots of our community members are nervous. So please stay close to your districts. Offer incredible patience and grace to our superintendents and school boards, who I think have the most difficult job I have ever observed in the state of Washington's public education system. They're trying to deliver high quality teaching and learning at a time where they have got to focus on health and safety, constrained budgets at a time where, quite frankly, it costs you more in many cases to do this well. So stay close to your districts, offer tremendous grace, understand the complex situation they're in. We're going to continue to fight hard at the federal level for resources to get that testing, to get childcare in place for families, particularly those who have to be remote. And obviously, we want to make sure that we're better connected. That's been happening all through the summer. We've done training to get teachers more up to speed on teaching remotely. We've increased connectivity, and we'll be doing more of it. And the last thing I would say is, unlike last spring when the school system was shut down very abruptly, and actually every state was shut down, we now have a planning framework, no matter what model is chosen by districts, where there will be daily attendance, there will be daily and weekly schedules for students, there will be a contact and a connection for everybody, a high expectation of engagement that we didn't have in place last time because it happened so rapidly. So it's a very different world now. Unfortunately, this disease is with us for a while. More people will get it. The goal is to reduce hospitalizations and loss of life. And if that means keeping schools remote to start the year, please offer patients to your districts, because that's what they will choose. And that is a viable opportunity and option for them. But they've got to make sure critical learning occurs. They've got to make sure that students are engaged, and we will support them in their work to do that. Thank you. We'll be back in a couple of weeks with updates. Please send in questions as you always do, and we'll make sure that we get as many answered as we can. But this is a pretty remarkable moment right now, and things are really changing in the country, and unfortunately not for the better, and we have to respond and adapt to it. Thanks, everybody.